Our next speaker is Kirsten Koehler. She's an assistant professor in the Johns Hopkins Bloomberg School of Public Health. Dr. Koehler is interested in developing novel aerosol samplers to improve the relationship between exposures and health effects. She has investigated novel, low-cost aerosol samplers in her laboratory, such as those using polyurethane foams to mimic the site-specific deposition of aerosol in the human respiratory tract. Dr. Koehler?
So thank you for allowing me to speak here today. My background is more in air pollution exposure assessment, and I feel relatively new to the game compared to many of you, so thanks for allowing me to speak here today about particle deposition, which is something I'm interested in for a wide range of applications. When we're thinking about aerosols, part of the challenge is that we really have a wide range of aerosol sizes to contend with. In occupational studies, we consider particles up to even 100 microns in diameter, which you could see kind of the edge of what a particle like that would look compared to something like PM10 that we hear a lot about in the EPA, a more 1 micron particle, and then the small particles that are more relevant to a combustion process are on the order of about 0.1 microns, which would be, you know, the little dot in there that you can't even see in this image. So we're talking about 4 to 5 orders of magnitude in particle size that we must contend with when we're thinking about particle deposition. And ultrafine particles, or those with diameter less than about 100 nanometers, are a particularly important and potentially toxic component of this this distribution. And so if we think about a human hair, you know, the PM2.5 and PM10 that we talk about a lot in terms of the EPA, you know, they look small even by comparison, but an ultrafine particle, you know, multiple of those would fit across one of these little pink ones, right? So we're talking about these very teeny particles. They've been shown to be especially toxic on a per mass basis compared to the larger particles that we often encounter. Some of these processes may be a little bit less relevant for a primarily liquid-based aerosol that we have in the case of an electronic cigarette, but it's an important factor to keep in mind that these ultrafine particles can be particularly important for health effects. I think about this in terms of the environmental health paradigm, where for an e-cigarette, perhaps we're most interested in this bottom half of the graph where we have an intake of an aerosol. Some proportion of that as a function of particle diameter will be deposited into the respiratory tract. That will lead to a dose and potentially to a health effect. However, if we have electronic cigarettes being used in the presence of other people, then we may have emissions and exposure to other nearby people from the ambient air as well. When we think about health effects, where these particles deposit can be very important. And that, of course, is a strong function of their particle size. So on this graph here, I have particle diameter in microns, and this is on a log scale. Almost every graph I think I showed today is on a log scale. And we often, when we're thinking about exposure to something like air pollution, we think about it in terms of intake, but that really may not be the most relevant metric. So if we think about the fraction of particles that are inhalable, almost all particles less than about a micron are 100% inhalable, and that tails off for much larger sizes. But the fraction of those that actually deposit is very different. And so the fraction that deposits in the upper head airways region is represented by what's shown in the shaded region. So as we get to larger and larger particle sizes, almost all of those particles deposit into the head airways regions. But in this size range where we're most interested for combustion-related or e-cigarette-related products, the fraction is much smaller. If we think about what's making it into the trachea, you know, we recognize that not all the particles even can penetrate to that region, but the fraction is much lower. Because of the geometry of the system here, only a small fraction of particles of any size really deposit into the tracheobronchial region. And then within the respirable or into the alveolar fraction of the airways, you see the smallest particles are depositing deep into the lungs, and some proportion that have not deposited in the larger upper airways do deposit into the deep respiratory tract. And so if we add up all those different regions together, this is what we get for total deposition. So nearly all of the particles of the smallest sizes and the largest sizes deposit into some region of the respiratory tract. But really, there's this large fraction in the middle here of sizes between, say, 100 to 400 or 500 nanometers, where most of the particles actually don't deposit in the respiratory tract, or instead exhaled back out into the room, potentially, where other people might be exposed. So, of course, this can have potential impacts on health. If we're thinking about particles that deposit in the head airways, the traditional example is very large particles like pollen. They're going to deposit into your nose or your mouth. It can potentially make you sneeze, whereas those smaller particles that really can penetrate deeper into the respiratory tract and deposit into the alveolar regions tend to be these smaller cigarette or combustion or vapor related size distributions, which can make you cough. They also have the potential to be to stay in the respiratory tract longer, where there's fewer mechanisms to remove those particles. But there are a lot of challenges in trying to actually measure these size distributions. Of course, there's going to be many differences that we see between e-cigarette characteristics themselves. So some researchers have shown differences between the carrier that's used, the nicotine content, whether flavorings are present or not, and then the physical properties of the device itself, including whether it's a rechargeable or disposable type and what generation it is, potentially temperature, although maybe not as important as our previous speaker has mentioned, and then the puffing time or volume are going to change, at least the number, concentration, and potentially the size distribution as well. So those are things that are really inherent to the e-cigarette itself. But what really, I think, in my mind, makes this challenging is what is related to the experimental conditions and trying to actually measure these. These devices that are used to measure particle size distribution, especially among the smallest sizes, need continuously operating flow and at a standard flow. And so they're not really amenable to measuring something that's trying to be done as a puff. So instead, you need to put this aerosol into something and then sample off of it. And really what you do in terms of dilution and the size of the chamber can have a dramatic impact, where we're thinking about whether smallest particles are allowed to coagulate and potentially the volatilization of semi-volatile or highly volatile species. The time between the puff and the measurement can be important. Most of these instruments measure sizes sequentially, and so you can't measure all sizes at once. There are a few instruments that do that. They're very expensive, and not that many labs have those devices. So instead, we're kind of getting an evolution as we're trying to measure the size distribution. And then the temperature and humidity can be very important because particularly these carrier species can be very hygroscopic. And so you can be changing the size distribution if you're not measuring at conditions that are relevant for the exposure. So there actually aren't very many studies that have been published on the aerosol size distribution. I've tried to grab as many as I have seen recently. And this is one study that looked at aerosol size distribution. Again, we have particle diameter shown here in nanometers on the log scale on the x-axis. And they've shown for two different nicotine contents changes in the aerosol size distribution. And so there's a strong peak at 100 to 200 nanometers in size. They see higher number concentrations generally, especially in this somewhat larger mode for the high nicotine content solutions. But there's also this long tail of particles out into the submicron, the ultrafine range, that I think is very interesting. And if we compare to what they found for a conventional cigarette, is really very different. They found, their peak here was at a somewhat larger size, and that the tail of ultrafine particles is noticeably missing from a conventional cigarette. There's another study that found for a different product, they measured the size distribution, what they called immediately after, 10 seconds and 40 seconds later. And so they don't see a huge change in the size distribution, but certainly a large change in the number concentration, which is reflective of the need to dilute to be able to allow these aerosols to age. On here, in this dashed line, is cigarette concentrations at 10% of the number concentration. So they see a much higher peak for cigarettes in this study, whereas the previous study had found much more comparable concentrations. And then again, you also can see here the generally larger mode size, as well as the absence of these ultrafine particles for a cigarette size distribution. This is some data that we collected. We were interested in trying to generate e-cigarette smoke into a small exposure chamber. It was about 1 liter where we were exposing mice. This is a publication that we're putting together and hope to submit in the next couple weeks. My postdoc, Nima Al-Mahajer, collected all of this data. And so you can see, we see somewhat of a different answer. Again, we see a peak in the size distribution at just above 100 nanometers. So that's what's similar to what others have seen, as well as, you know, a large tail into the small particle sizes. Again, this is on a log axis here, so our peak size distribution measurements here are 10 to the 9, compared to where we also looked at the larger particle diameters, which is often missing in a lot of the literatures. They've done a good job of characterizing the smallest particles, but perhaps haven't either had the instrumentation or haven't hooked it up to look at the micron-sized aerosol. And although the number concentrations are much, much lower of those large particles, they are present. Interestingly, we found that our nicotine solution isn't that much different, and perhaps even a little bit of a smaller size distribution or smaller number concentration compared to the propylene glycol alone conditions. So some inconsistencies between studies. This was another study where they were intending to capture what the impact would be on indoor aerosol, and they've used 4 different electronic cigarette products. I apologize, this doesn't reproduce very well here, but the black triangles here are for tobacco smoke on a very different scale. So this is 200,000 DMD log DP versus 1,200 for the cigarette product, or for the electronic cigarette products. What I think is interesting here again is that you see a very narrow distribution for the cigarette smoke, and about 10 times higher number concentrations compared to the electronic cigarettes, but really this long tail. And I think what's also interesting in this study is because they have looked at multiple products at this using similar methodology, you can see quite a variability in terms of where peaks are, from being less than 100 nanometers for this product to some that are even bimodal, potentially trimodal in size distribution when generated in this somewhat larger chamber. Finally, this last study tried to look at impacts on indoor air by generating an 8-meter cubed, or more of a room-sized chamber. And so what they found was that you get this buildup of these ultrafine particles, where you still have this mode of the larger particles, but that this size distribution is much broader than what was really observed for the traditional cigarette, even though the number concentrations for the cigarette, again, were found to be higher than for the electronic cigarette. I only found one study where they actually tried to estimate particle deposition. They used similar equations to those I showed earlier. That's for the ICRP model, excuse me, where you can take the size distribution measurements and then apply these equations that tell you what proportion of particles as a function of size would deposit into each of the regions of the respiratory tract. And so for their 2 types of devices that they use using either a PG or a VG carrier, they found that there actually wasn't that much difference between the 2 different devices and 2 different e-liquids, but that in both cases about 75% of the particles were actually exhaled. And that's somewhat higher than what they found for their traditional tobacco cigarette that was more in the 65 to 70% range. Most of that difference seems to come from a reduction in deposition in the head airways region compared to the tobacco cigarettes, whereas in the tracheal bronchial it's expectedly small for all cigarette types, And for the alveolar region, it's fairly similar between 9 and 12% of the distribution. So it seems to be driven by the changes in those particles that deposit into the head airways region. I did want to point out some challenges with this type of methodology. Most of these models, for example, the ICRP model that we've discussed today, it's based on deposition in healthy adults. The majority of the data is collected for healthy young men. The ICRP model has collected more data to look at deposition in women. Women have generally smaller heads, and so the deposition in the head airways region tends to be higher. But very few studies have looked at deposition for those with respiratory conditions. So if we're thinking about how this might be different for people who have been smoking for a long period of time, I think that's an important thing to consider is the deposition pattern different for people who may have COPD or other respiratory conditions that may impact their deposition. And then, of course, these uncertainties related to the particle size distribution are going to be very important when we're trying to then estimate particle deposition. So we're taking, an uncertain size distribution, multiplying it by an uncertain particle deposition, and then trying to say something about the fraction of particles that are depositing into each of the regions of for a real person can be a challenge. So in conclusion, there seems to be quite a bit of evidence to suggest that a large proportion of particles from e-cigarettes will be exhaled. That's really because there seems to be more or less a consensus that the peak of the size distribution is in that 100 to 300 nanometer size range, which is really not deposited efficiently in any part of the respiratory tract. In atmospheric science, we call those accumulation mode particles because they aren't effectively removed by anything, and so that's perhaps actually good for the e-cigarette users. But there's still a lot of inconsistencies between the studies. Some suggested that the total number concentration for e-cigarette devices was similar to that for traditional tobacco cigarettes, but more of the studies suggested that the concentrations were about 10% of those for traditional cigarettes, especially when they were being measured in larger volumes. So I think there's maybe some experimental challenges to contend with here that relate to some of these inconsistencies. And then we, in our group, as well as others, when we compared to the literature, we found differences in what we expected for size changes with nicotine content, and other device differences are not really consistent between studies on which direction you expect changes in number concentration or in peak particle size. So I think really this probably in many ways relates back to the experimental design, and very few studies have characterized a wide variety of products using the same setup. And so perhaps that data is being collected, as we've heard, but it'll be interesting to see, because I think that's one of the things that's really lacking from the existing literature today. With that, I'm happy to take any questions.
One question I have. You had just mentioned the lack of studies for those who have pre-existing respiratory conditions. And since part of the issue appears to be the use of e-cigarettes for smoking cessation, how do you feel that may impact in our ability to make judgment, well, to be able to explain what is going on with the use of INS?
Yeah, I think some studies have found increased deposition of particles in people with different respiratory conditions, and so it's important to consider, do I know exactly what the direction will be? I don't. There are some groups at Lovelace, and Chong Kim has done some work looking not specifically related to e-cigarettes, but just in general on particle deposition changes with lung disease and things like that. So I think that literature is starting to develop, but there are actually very few groups that are looking at it, so it's still pretty minimal. Yeah.
So with e-cigarettes, you're looking at liquid particles in the aerosol, but with cigarettes, you're looking at, I'm presuming, primarily solid particles. And e-cigarette aerosols dissipate very quickly, just the particle. Do you have any sense of the rate of evaporation, how small these particles get over time?
So there have been some studies that I've seen that have looked at time course over fixed conditions, and then have also tried to, I guess, burn off all of the volatiles by heating the airstream prior to sampling. I don't know what that's particularly relevant to, since I don't breathe through a 100-degree furnace before not that I smoke cigarettes, but if I were to, I wouldn't do that either. So I think that's a challenge, and it's something that makes measuring these really challenging, because in our study, we were trying to basically minimize the distance between the generation and our exposure chamber, but we didn't temperature or humidity control along the way, and you have to put in ventilated air, so it starts to get really challenging to try to control those parameters.
Can I ask a follow-up, or do we have time?
We need to go on. Thank you.